Hi, I'm Ken Cutbush. I'm an orthopaedic shoulder surgeon working in Brisbane. I'm with Lucy Angelini today. Lucy's a physiotherapist. She works for Extend Rehab, and many of you will see Lucy in the offices when you come back for your post-op rehab. She'll be seeing you as the physiotherapist. So I've invited Lucy along today to talk about the rehab around Latarjet surgery. So if you're going to have an arthroscopic Latarjet and labral repair, what to think about when you're preparing for that surgery, and then to know what comes afterwards. So, Lucy, what do people need to think about when they're planning to have a Latarjet procedure, when they're coming up to that procedure? What do you suggest to them?
So oftentimes these patients have had instability for a while, and so they've been managing that with their local therapists. So lots of work around strengthening their rotator cuff and getting their proprioception as good as it can be prior to the surgery. A lot of these patients are younger, more athletic, patients who are looking to return to sport. So maintaining as much strength and conditioning as they can before the surgery is really important.
Yeah. So then they have their surgery, they've come back from recovery, and it's the next morning because you're in overnight, and then the next morning you will see the physiotherapist. What's happening at that visit in the hospital with the hospital physio?
In the hospital. So you'll be seen by the St Andrews physios, and they're going to teach you how to don and doff your sling safely. The main thing with this rehab is protecting the bone block that's trying to heal. So the coracoid process, healing to the anterior glenoid. And so we want to make sure that we don't activate the biceps muscle. So we're not doing any active elbow flexion. So when we're bending your elbow, which is important to do because we don't want your elbow to stiffen up, we have to do it passively. So we have to use your other hand to move your elbow. So we don't want the biceps to contract and shorten and pull on that bone block.
Yeah, so no lifting. The block of bone that we transfer, we take the coracoid process off, and I transfer it through the subscapularis to the front of the socket of the shoulder, the glenoid, and that's then fixed with 2 screws. It has the main bicep tendon attached to it, the short head of biceps, along with the conjoined tendon, short head of biceps, and the coracobrachialis. And they're very strong muscles, and they'll pull on that. If you're lifting, and even just little things, coffee cups and so on, because a lot of people think they're in the sling, as long as they're in a sling, they're fine. But with the Latarjet, it's very important not to actually contract that biceps muscle because that'll pull on that bone block. And I have had a patient actually pull it off. Admittedly, he went to the gym and did bench press in the first 2 weeks post-op. But what I also see is the bone block slow to join up, slow to unite, slow to heal. And that's because it's moving. Bone joins up when it's quiet. So if the biceps are pulling on that block of bone and tugging on it and jiggling it, that will slow down the union process and the healing process. And we want that to heal up quickly because as soon as it heals, we can take the restraints off and let you go ahead with your physio. So that is very important. No elbow flexion. We do a lot of movement though, don't we? More movement than for any of the other rehab protocols, really.
Exactly. Yep. So your external rotation we take out to about 45 degrees. Your forward flexion we take to about 120 degrees. We make sure that you're moving your adjacent joints. I'd love to.
External rotation, because that is something that people need to know.
So yes, when you're doing external rotation, so oftentimes you're standing against a wall or having a towel in underneath your elbow, you're making sure that your shoulder blade's in a really nice up and back position, and it's passive, so you're using a stick, or in the hospital room we do it with a coat hanger, and you're using your good arm to stretch your operated arm out to the side, and you keep your elbow nice and close.
Yes, because it's easy to sort of lift your arm away and then think that's external rotation, and that's a normal thing. But what we want is for your elbow to be in close on your ribs, or if there's a towel there, pulling the towel in on your ribs, and then to twist out like that way out. That's external rotation. That's a very important range of motion for the shoulder. If that's tight long term, that will bug you. So we do want to get that external rotation out. It's very important for your functional health of the shoulder, and also for your general well-being about the shoulder. Tight external rotation is troublesome for patients, and it usually bugs them a fair bit. So we want to that is something we really do want to stress, that we want that external rotation. No elbow flexion, but external rotation.
Exactly.
Now the forward flexion.
And the forward flexion, so you'll find something that's about waist height, so a bit higher than this, kitchen bench at home. Hands about shoulder width apart, and just shuffling your feet back, and then gently poking your hips out behind. And so we measure the angle between your arm and your trunk. And so we're looking for that to get to about 120 degrees.
Can you show them 90? That's 90 there. So we actually would like you to go a bit further than that. So start with 90, but then we want you to ease into about 120, which is a fair bit.
Yep. So you're allowed to move your shoulder,
Yeah.
just not actively bend your elbow.
Yeah. Yeah. The other things I think is very important to make sure that you get sorted with your with the physiotherapist that the morning after surgery is just the simple things. How to put that sling on. Make sure that you really get how to put that sling on. If you're not quite sure the first time they show you, ask the physio to show you a couple of times so you've really got it in your head how to adjust and get it on. We put it on in theatre when you're lying down. It needs to be fitted with you standing up. Of course, we can't do that when you're still just waking up from the anaesthetic. It's done with the physio the next morning. Make sure that you've got in your head how to have a shower safely, how to get through that, and how to put a shirt on, and all those sort of things. Because you don't want to get home and go, oh, how do I do this safely? So get it sorted with the physio that morning and go through it with them. They're really, really important things. Often as professionals, we're thinking about the external rotation, the forward flexion, all those sort of things. But these basic little things of how to put a shirt on, how to have a shower, how to fit the sling are things that you will want to get sorted in your own mind.
Important to you, absolutely.
Yep.
Yeah.
So now going home, that first 6 weeks, what are they doing for the first 6 weeks after the Latarjet procedure?
Yeah, so it's pretty low key in terms of your physio. You're just doing the exercises that you've been shown in hospital. We're waiting for it all to heal, so nothing too exciting. Once you start to feel a bit more like yourself, then going for some nice walks in the sling is a beautiful idea, but nothing, too vigorous while it's all healing for those first 6 weeks.
Yeah, look, but the Latarjet, we're looking at that first 6 weeks. And then I'm seeing you back at 6 weeks post-op with a CT scan. If that CT scan shows that it's healed up, that the bone block is joined to the front of the socket, the glenoid, then it's happy days. We're moving on pretty vigorously from there. So, and that's dependent on the 6 weeks of staying quiet and letting that bone heal up.
Yes, and then that 6 week appointment is pretty exciting.
Yeah, so at 6 weeks post-op, we'll get you back, take you out of the sling. We'll have a look at your range of motion. We'll have a look at the CT scan, and we'll examine it together. And what we're looking for is that it's joined up. It's a good position. It's joined up. Screws are all good. All those sort of things need to be checked out. But if it has joined up, I will be giving the all clear to push through rehab, and I won't be giving you any restrictions as such. Once it's joined up, I'm happy for you to accelerate your rehab program as you can with the physiotherapist. Now, you won't be able to suddenly do everything because, believe me, after 6 weeks in a sling after a Latarjet, the shoulder will be tight, your muscles will be deconditioned, so you have to get your range of motion back, have to get a little bit of strengthening. But I'm not holding you back, which is a great thing.
It's a wonderful, because they are often a younger patient group, so it's wonderful they get to really push themselves, and they often have sporting goals that they're trying to achieve. So it's nice to be able to work with their local therapist in order to get their range and then start their strengthening sort of as their shoulder allows. There's no set time restrictions anymore, no waiting for the next 6 weeks. You can just go for it.
And the difference with the Latarjet at 6 weeks compared to a labral repair that we'll do, because I do the labral repair with the Latarjet, the bone block is fixed to the front of the shoulder and the labral repair is over the top. But the difference in rehab between that Latarjet procedure and a straightforward Bankart repair or labral repair without the bone block transfer is that all the stabilizing force of the shoulder is being directed on the labrum in a pure labral repair, whereas with the Latarjet, the force is being borne by the bone block and the conjoined tendon. So once that's united, that is then supporting and protecting the labral repair, and it's not critical on the labral repair. It's not being pulled off by movement because the strength of the repair is dependent on that bone healing rather than the labrum. Whereas if it's just a pure labral repair, cartilage does not heal to bone as anywhere near as fast as bone heals to bone. And so we've got to protect you longer because everything's reliant on that healing, and it's very easy for it to pull apart. It really does need 3 months to get some strength there. So that's the big difference.
Yeah, and that's key for local physios to understand.
Yeah.
Because they see that on the op note that there's a labral repair, and so they're sort of treating it as they normally would.
Yeah.
So it's
and
wonderful.
There is a big difference between those two. And I've seen that with patients I've gone back and scoped. I've never seen a labral repair come apart when the bone block is united successfully early on. And And so there are pros and cons. The Latarjet is a bigger operation, has more surgical risk, nerve injury and bone block issues, but there are upsides in terms of the rehab and the speed of the rehab.
Absolutely. Yeah.
So then the next step is to see you back at 12 weeks post-op. What do we do then, Lucy?
So you take a little video of their active range of motion. So we're making sure
we'll be videoing your range of motion then.
That's come back. Especially looking at that external rotation like we were talking about. And then we start really focusing on getting it strong, getting your proprioception. Oftentimes, these patients have been troubled up into that stop sign position for a long time, so building up their confidence.
That is something, isn't it? Someone who's had multiple dislocations can be really apprehensive and really nervous about putting their arm up like that. And it takes a while for them to realise that it's actually safe and stable, doesn't
Build
it?
confidence in it. It takes a long time. And oftentimes they've had labral repairs and revisions.
True.
And so it hasn't gone well for them before and they've re-injured. So, definitely building their confidence is wonderful. Yep.
So that 12-week will be pushing really what we were hoping to push through is strengthening. And most people, that's where we are. Well, that will be where we are. Some people will have to push a little bit more on the range of motion just to tighten their external rotation, but that's the plan. So the next routine visit is at 12 months, and what we're doing then, we'll get a CT and X-ray. What we want to check is the bone block, confirm the bone block is united and healed as it should, make sure the screws and washers are in the right position. And then we're looking at the shoulder and assessing it. We want to look at the range of motion. We want to look at stability. And what I find is around about 2, maybe 3% of patients are actually really tight in their external rotation. And with the Latarjet, that's due to scar tissue. The scar tissue can form between where we've taken the bone block off the osteotomy site, because there's a raw surface of bone there, and you get scar tissue from there down to where the muscle's been split. The subscapularis muscle at the front of the shoulder has been split, so the bone block can go through to the front of the shoulder, and you get scar tissue across the front there that tethers the shoulder and tethers your external rotation. It's actually a very simple thing to arthroscopically go in and remove that tether, and that will then give you back your external rotation. You don't have to go into a sling. It is one night in hospital, but the recovery is very fast. Usually will set you back a week or two roughly, and it's a good thing to do at that stage in that very small number of patients that do have that tight external rotation. The other thing I find is there's a very small group, maybe 1 or 2%, that feel a little loose in the shoulder. They're not dislocating as such, because the Latarjets are very robust in terms of stopping patients from dislocating, but they might find that the shoulder's moving around a bit, and in that case I may do a little stabilizing procedure, a further arthroscopic procedure, usually at the back of the shoulder. It's called a remplissage. We put anchors into the Hill-Sachs lesion, the dent in the back of the humeral head that you get from the initial dislocation. And that will just tighten the shoulder up, stiffen up a little bit, and that is usually very successful in those patients that still feel a bit unstable, and gives them a bit more security. That, of course, is 1 night in hospital and 6 weeks back in a sling, so it's a bit more significant. So that's what we're doing at 12 months. What are the physios doing at 12 months?
So 12 months we're testing your strength and just making sure that that's getting up to the other side, and then just having a look at any other sort of sports-specific requirements they need. So if they're a throwing athlete, making sure their proprioception overhead is really good. If they're a swimmer, sort of, making sure their range is appropriate for all their strokes. Helping them, individualize their program, make sure they get exactly what they want out of it.
Good.
Yeah. But
Right.
by 12 months, they're usually, well and truly back to where they want to be.
Yeah. So thank you for listening to us. That's the overview of rehab for arthroscopic Latarjet and labral repair, and thank you for listening.
Thanks.